Have you ever paused and asked yourself, could those little memory lapses be more than just age catching up with you? What if forgetting a name or misplacing your keys wasn't just about aging, but something more serious, like the early whispers of dementia? In this video, we're pulling back the curtain on a condition that impacts millions globally, but is still surrounded by myths, fear, and far too many unanswered questions. We'll explore what dementia actually is, clear up the common confusion around it, and highlight 9 early warning signs that are often brushed off or overlooked. We'll also dive into the 13 most recognizable symptoms and show you simple, science-backed steps to support long-term brain health. Because yes, there are things you can do right now to strengthen your mind and protect your memories. So stick around until the end, where we'll share exciting new developments in dementia treatment that offer fresh hope to millions of families. Let's start with the basics. What exactly is dementia? Dementia isn't one single disease. It's a term used to describe a group of symptoms that affect memory, thinking, behavior, and the ability to perform everyday tasks. It happens when brain cells become damaged or stop communicating properly, making it harder to think clearly, remember things, or even speak the way you used to. And here's something most people don't realize. Dementia is not a normal part of aging. Sure, as we get older, it's common to forget a name here or there. But dementia goes way beyond that. It disrupts daily life in a major way. In fact, most older adults will never develop dementia. So if you or someone you love is experiencing ongoing confusion or memory issues, don't chalk it up to getting older. Get checked. Now let's talk about the 4 main types of dementia you need to know. First, there's Alzheimer's disease, the most common type. It usually starts with memory loss and gradually affects language and behavior. Then there's vascular dementia, often triggered by reduced blood flow to the brain, sometimes after a stroke. Lewy body dementia brings cognitive ups and downs, visual hallucinations, and symptoms that resemble Parkinson's disease. And finally, frontotemporal dementia. This one changes how a person acts, speaks, and relates to others, usually in their 40s to 60s. Knowing the type of dementia matters. It helps doctors guide treatment and care more effectively. Now, let's look at the first 2 early warning signs, often missed but incredibly important to spot. 1. Struggling to find the right words. We all have moments where we can't find the word we're looking for. But if this happens regularly, if someone constantly uses vague fillers like thing or that stuff, or mixes up common object names, it might be more than just distraction. Long pauses in conversation, misusing words, repeating the same phrase. These can all be early signs of cognitive decline. And the ripple effect is real. It becomes harder to communicate, and that leads to frustration and even pulling away from friends and family. Catching this early can make a huge difference in getting help and support. 2. Subtle changes in the senses. Vision problems, trouble hearing conversations, not being able to smell your favorite foods. These aren't just sensory issues. They can be clues to something deeper. A person might have trouble recognizing familiar faces or struggle to judge distances, which can lead to falls or minor accidents. They might mishear things, especially in crowded rooms, making it harder to follow conversations. Or their taste in food might suddenly change, leading to appetite loss or nutrition problems. These seemingly small changes can quietly erode a person's quality of life, and they're often brushed off until they become impossible to ignore. That's why noticing and understanding these early signs matters. When caught early, dementia can be better managed, giving the person more time, support, and quality of life. 3. A subtle shift in taste, smell, and appetite. Has someone you care about suddenly lost interest in their favorite foods? Or do meals that once brought joy now seem bland or unappealing? Changes in the senses, like taste and smell, might not seem like a big deal at first, but they can be an early clue that something deeper is going on. People in the early stages of dementia might struggle to smell familiar scents or detect flavors the way they used to. That can lead to skipping meals, eating less, or simply losing the desire to eat altogether. Over time, it affects their nutrition, energy levels, and mood. These changes may feel small, but they can quietly chip away at someone's well-being. When someone turns down a favorite dish or complains that food tastes off, it's worth paying attention. 4. A loss of motivation. That's easy to miss. Let's talk about something that's often mistaken for laziness or low mood, but could be a red flag. Apathy. We're talking about a slow, steady drop in motivation. Maybe they stop gardening, ignore hobbies they once loved, or pull away from social activities they used to enjoy. Tasks they once handled with ease start to feel like a burden. But here's the key difference between apathy and dementia and depression. There's usually no deep sadness, no emotional distress, just a flatness, a lack of drive. This isn't just about skipping an event here or there. It's a broader loss of interest in life's little routines. And it's something that can creep in quietly. Recognizing this early is vital. The earlier we notice, the earlier we can step in and offer support. 5. Muscle weakness. That has nothing to do with age. When we hear muscle weakness, we often think it's just part of aging. But in some cases, especially with vascular or Lewy body dementia, physical weakness may actually be one of the first signs of brain changes. We're talking about things like feeling unusually tired, trouble with fine motor skills like buttoning a shirt or brushing teeth, needing help with walking or balance, or experiencing more frequent falls. These physical issues aren't just about muscles. They can reflect problems with how the brain is controlling movement. If someone you know starts moving differently, seeming more unsteady or fatigued, don't overlook it. A full evaluation could uncover an important piece of the puzzle. 6. Getting lost in familiar places. Imagine stepping outside for a walk in your own neighborhood and suddenly not recognizing where you are. That's the reality for many people in the early stages of dementia. Spatial disorientation is one of the more alarming symptoms. Someone might forget the way home from a store they visited for years, or get turned around inside their own house, unable to remember which door leads to the kitchen. This confusion can cause anxiety, and in more advanced stages, even pose a safety risk. When this kind of disorientation starts happening, it's time to have a conversation with a doctor. Getting help early can mean the difference between staying independent or needing more hands-on care. 7. Trouble sleeping, especially at night. Sleep disturbances are another lesser-known clue. The person might have a hard time falling asleep, wake up multiple times throughout the night, or feel overly tired during the day. But it can go beyond that. There's something called sundowning, a pattern where someone with dementia becomes more confused, agitated, or restless during the late afternoon and evening. It's tough on both the individual and their caregivers. Sleep plays a massive role in brain health, and when it's disrupted, everything else starts to fall apart. That's why recognizing and managing these patterns early is crucial. Whether it's through better sleep routines, natural supports, or medical care, protecting rest is one of the most important things you can do for cognitive health. Let's continue unpacking the subtle yet important signs of early dementia and a few of the more classic symptoms you should never ignore. 7. Changes in posture and walking. Have you noticed a loved one starting to hunch over slightly or hesitate before taking a step? That shift in posture or the way someone walks, maybe it's slower, a bit unsteady, or comes with short, shuffling steps, might not just be age catching up. These changes can be one of the early signs of cognitive decline, particularly in types like Lewy body or vascular dementia. Over time, these walking issues may increase the risk of falls, which can further reduce independence. It's not just about balance, it's about what's happening inside the brain that controls those movements. If this sounds familiar, don't wait. A physical therapist can step in early with simple exercises and mobility support to help keep things stable and safe. 8. When simple tasks become surprisingly complicated. Another key warning sign is when basic daily tasks, things like paying bills, preparing a simple meal, or using familiar appliances, start to become confusing or overwhelming. You might notice that someone forgets the order of steps, stops midway through, or doesn't know how to finish something they've done for years. This isn't just forgetfulness, it's a disruption in task management and focus that can lead to frustration, mistakes, and growing dependence on others. If you see these changes, it's a good time to gently encourage a medical evaluation. Early diagnosis opens the door to tools, routines, and support that can keep life manageable for much longer. 9. Losing interest in talking or connecting. Sometimes, one of the most heartbreaking early signs is silence. When someone begins withdrawing from conversations, stops initiating social interaction, or loses interest in connecting with others, it could be a symptom of apathy, a condition known in medical terms as anhedonia. Unlike depression, there's no deep sadness here. It's just a gradual fading of interest in things that once brought joy, conversations, hobbies, even family gatherings. This loss of engagement can be easily overlooked or misunderstood, but it's often one of the first things to change in someone experiencing cognitive decline. Recognizing it early gives us a chance to re-engage and bring in meaningful support. Now, let's move into the 13 classic symptoms of dementia you need to know and look out for. 1. Struggling to follow conversations. If someone constantly loses the thread of a discussion, especially in a group or noisy environment, that's a red flag. They may ask people to repeat things often or give vague responses because they're not tracking what's being said. Speaking slowly, keeping sentences short, and eliminating background noise can help, but it's the pattern that matters most. 2. Losing track of time. Forgetting what day it is, or confusing the year, season, or even the time of day happens more often in people living with dementia. They may mix up timelines or think something that happened last week occurred years ago. Using calendars, clocks, or routines can help ground someone and ease this kind of disorientation. 3. Difficulty making decisions. Everyday choices can become stressful or even impossible. From deciding what to wear to managing finances or scheduling doctor appointments, someone with dementia may feel overwhelmed by options or unable to decide at all. Offering simple, guided choices and a little extra time can make a big difference. 4. Pulling away from others. Social isolation is a serious symptom that often gets missed. A person may stop attending family events, avoid phone calls, or show little interest in interacting, even with those closest to them. Sometimes, this is because it's too hard to follow conversations. Other times, it's embarrassment or fear of being judged. But either way, isolation can accelerate cognitive decline. Gentle encouragement, adapted activities, and support groups can help rebuild connections. 5. Acting inappropriately. Outbursts, rude remarks, or inappropriate behavior in public may be signs of dementia, not rudeness. This disinhibition can show up as verbal aggression, overly personal comments, or even unusual sexual behavior. As difficult as this may be, it's important to understand this behavior is a result of brain changes, not something within the person's control. Calm redirection and environmental adjustments can help. 6. Short-term memory loss. Forgetting recent conversations, repeating questions, or misplacing items happens often in the early stages of dementia. What's interesting is that long-term memory, such as childhood events, might still be intact at first. Tools like reminder notes, labels, and even photo albums can help support short-term memory. Now, let's explore the remaining warning signs, some of which are often misunderstood or mistaken for unrelated health issues, especially in the later stages of dementia. 7. Hallucinations. Seeing or hearing things that aren't there can be incredibly distressing for both the person experiencing them and their loved ones. Hallucinations are especially common in Lewy body dementia. Visual hallucinations, such as seeing people, animals, or even entire scenes that don't exist, are the most frequent. But some individuals may also hear voices or feel phantom sensations on their skin. Here's the important part. Instead of arguing or trying to snap them out of it, it's more helpful to gently redirect or validate what they're feeling. Staying calm and reassuring can ease their fear. In some cases, medication may be needed, but emotional support always comes first. 8. Incontinence. Urinary or fecal incontinence can emerge in the moderate to advanced stages of dementia. The person might not recognize the need to use the bathroom, forget where it is, or struggle with clothing fasteners in time. Beyond the physical discomfort, this symptom can deeply affect their dignity. It may lead to embarrassment or withdrawal and add stress to caregivers. Helpful strategies include using adaptive clothing, creating easy-to-navigate spaces, keeping a consistent bathroom schedule, and using incontinence products. It's about maintaining quality of life and ensuring the person feels safe and supported, not ashamed. 9. Sudden mood or behavior changes. If someone suddenly shifts from calm to agitated or from cheerful to withdrawn, without a clear reason, it could be more than just having a bad day. Rapid mood swings, frustration, social withdrawal, or even verbal outbursts and inappropriate actions, including sexual behavior, can show up as dementia progresses. This is due to changes in the brain that affect emotional regulation and impulse control. It's not intentional, and it's certainly not personal. These shifts can be especially tough on family members, but understanding the cause helps. Gentle communication, structure, and behavior-focused strategies can ease tension for everyone involved. 10. Putting things in strange places. Ever find a phone in the fridge or car keys in the bathroom cabinet? One of the more noticeable dementia symptoms is misplacing items in unusual spots and then not being able to find them again. This can lead to accusations of theft or confusion and stress in the household. To manage this, try setting designated places for essential items and avoid confronting the person. Instead, calmly help them retrace steps or use simple visual cues around the home. 11. Trouble solving problems or planning. Even basic planning or problem solving can become overwhelming. What once seemed easy, like paying bills, following a recipe, or planning an event, now feels confusing or impossible. This happens because the brain struggles to process steps in order or hold multiple pieces of information at once. To help, break down tasks into smaller steps and reduce the cognitive load. Sometimes all it takes is a gentle guide and a little extra time. 12. Total disorientation in time and space. Losing track of the day is one thing, but forgetting the season, year, or even getting lost on your own street is something else entirely. This level of disorientation can be frightening. It increases the risk of wandering or becoming confused in unsafe situations. Calendars, clocks, clear signage, and daily routines are all essential tools for managing this symptom and providing reassurance. 13. Repeating the same questions. Repetition is one of the most common and often most exhausting symptoms caregivers face. The person may ask the same question every few minutes, forgetting the answer each time. It's not stubbornness. It's a breakdown in short-term memory. Instead of reacting with frustration, try using visual aids, written notes, or gentle reassurance. Patience is key here, even when it's hard. Finally, let's wrap this up with a quick look at what's happening behind the scenes in the brain and what you can do about it. What causes dementia? While Alzheimer's disease is the most common cause due to abnormal protein buildup in the brain, there are others too. Vascular dementia stems from reduced blood flow, often caused by strokes. Lewy body dementia involves protein deposits disrupting brain signals. Frontotemporal dementia affects behavior, speech, and personality due to damage in the brain's front and side regions. Risk factors include aging, genetics, poor cardiovascular health, and unhealthy lifestyle habits. But the good news is many of these can be addressed. By recognizing these signs early, seeking help, and making proactive changes to lifestyle, you're not just managing symptoms, you're defending your brain's future. Let's now take a closer look at what's really behind the development of dementia, and more importantly, what you can do to protect your brain health starting today. One of the most common causes is vascular dementia, which happens when the brain is damaged due to poor blood flow, often the result of strokes, mini-strokes, or other circulatory problems. Another major type is Lewy body dementia, caused by the buildup of a protein called alpha-synuclein. This buildup disrupts the brain's ability to send and receive signals, affecting everything from movement to mood and memory. And then there's frontotemporal dementia, which affects the brain's frontal and temporal lobes. This form impacts behavior, decision-making, language, and even personality, often showing up earlier than other types. Each type of dementia has different triggers, but some risk factors overlap. These include advanced age, family history of dementia, cardiovascular diseases like hypertension and diabetes, poor lifestyle habits such as smoking, inactivity, or unhealthy eating. But here's the good news. While we can't change our genetics, we can take meaningful steps to reduce our risk. Research consistently shows that lifestyle choices play a powerful role in brain health. In fact, adopting healthy habits, like eating a balanced diet, staying active, sleeping well, reducing stress, and staying socially and mentally engaged, can actually help protect your cognitive function over time. Let's be clear, there's no guaranteed way to prevent dementia, but greater awareness and proactive choices can delay its onset and improve quality of life, and the momentum is growing. Scientists and doctors around the world are making exciting progress in slowing down the disease, improving treatments, and offering renewed hope to millions of families. So if you take just one message from this video, let it be this. Dementia is not an inevitable part of aging. You have more power than you think. By learning the signs, staying informed, and committing to daily brain-supporting habits, you're taking real steps toward a healthier future. And if this video helped you see dementia in a new light, or gave you tools to help someone you love, please give it a thumbs up and share it with others. We'd love to have you join our healthy care community by subscribing. Every week, we share practical, science-backed tips to help you live stronger, longer, and with more clarity. Together, let's build a future where brain health is a daily priority, not a final concern. Let's make every step forward count.